I'm Dr. Koide, I'm a cardiologist, and I'm here to go over a few things we are doing in this era of a pandemic to keep things safe for patients who are undergoing procedures, elective procedures, or any other need in the hospital here at Southern Hills Hospital. Unfortunately, it's not a live presentation, but hopefully we can cover some of the questions that are common to most people. I'm part of a group of cardiologists here. I'm Dr. Koide. Our group is called Las Vegas Heart Associates, and I'll have some information on how to get a hold of us. If you have any questions in the future, you can find me or find one of my partners to answer any questions that you might have. Our priority here at Southern Hills Hospital is to keep everything safe for every patient that comes in, for anything that is achievable. And most people are now familiar with social distancing and things that everyone is trying to do every day to keep their risk low. But I'd like to emphasize the fact that the emphasis in the hospital is always to keep it as safe as possible for every patient and every relative that comes into the hospital campus. These are some of the main things that we do to keep the risk of coming in contact with the virus as low as possible. Every person that comes into the campus every day gets their temperature checks at entry points in the hospital. Hand sanitation is mandatory, and that goes for every day, every person that comes in, and for employees and patients and relatives several times a day, as is everything else that we do regularly. Universal masking is mandatory. We're all wearing masks in this room, except for myself, so you can hear what I'm saying. I just removed my mask for the talk, but mask is pretty much a universal thing these days. And obviously social distancing, which is the most effective way to prevent coming in contact with this virus. From time to time, hospitals have managed to plan procedures that cannot be postponed. Obviously, emergencies are emergencies, pandemic or not, they need to be done. But for elective procedures, we want to optimize and make sure that we do the procedures that are needed in the right time at the lowest risk possible. So again, patients who coming for elective procedure are screened at the entrance, like I said. One visitor only is permitted for every patient that comes in, and that applies to pretty much any procedure done in the hospital. And every patient is tested for COVID prior to coming in for any elective procedure within 72 hours of that procedure, okay? So anyone who tests positive obviously will not have an elective case done. Emergencies, of course, are done no matter what because they're emergencies. And for those cases, obviously, every care is taken to minimize the risk, not only for the patient and relatives, also for the professionals in the hospital campus. So these are some of the procedures that are being scheduled today and these days. Pacemaker implantation, something that I do almost on a daily basis. Heart caths and stents. My partners do this part. I do more the electrical part. My partners do the plumbing part, which is caths and stents. Obviously, orthopedic surgery, general surgery, gynecological procedures, urologic procedures, oral surgery, colonoscopy and endoscopy, brain and spine surgery, and some other elective procedures that are still currently being done in the hospital. Obviously, things can change at any time depending on how the pandemic goes. But right now, with the current measures for safety, we are being able to do these cases. Okay? Sanitizing measures in the hospital. Every surgical operating room is cleaned every day, several times a day. And deep cleaning is something that is fairly universal now in every part of a hospital. All surfaces are disinfected, including surfaces and ducts and light fixtures. The lab, cath lab and endoscopy labs are deep cleaned every day, several times a day, as well as public areas, waiting areas, restrooms are deep cleaned every day, several times a day. And deep cleaning, like I said, involves cleaning more than we usually do, not only visible surfaces, but surfaces that are not immediately exposed to patients and relatives, very thoroughly cleaned with disinfectants all day, several times a day, again, to minimize the risk of coming in contact with the virus. Las Vegas Heart Associates is my group. We have 2 locations, one in the Southern Hills Hospital. It's right at the building I'm in right now, on West Sunset. And the other locations is on the Mountain View Hospital campus on West Tenaya Road. Every waiting area has these social distance measures to keep the number of patients to the point where distancing is possible. So at any time, there are not enough patients to create any difficulty keeping that 6 feet distance all day. We make that very much of a priority for safety for everyone, not just the patients, but also our employees and doctors and nurses. Okay? So every patient that comes into the office is going to be screened with this questionnaire. I know it's hard to see on the video, but it's the typical questions that we normally ask people in order to get a sense for how well they are and the likelihood that they are currently sick or contagious. Things like, do you have a fever, a cough, loss of taste, loss of smell, chills, headaches? Have you traveled to different areas? Have you been exposed to people who might be sick? And depending on their answers, then we have a response from the trained office team to prevent any accidental exposure within the office. So it goes from no action, from a person who says none of this applies to them, they're totally fine, to the extreme of patient being isolated and sent to the hospital and not being in contact with the other patients and visitors in the room. So this is done for every patient that comes into the office. And as I mentioned, coming into the hospital, there's always a screener that will ask a patient and every relative that comes in with them, which is currently limited to 1, as to whether or not they have these symptoms. Their temperatures are checked to make sure that we don't allow someone in that has signs or symptoms of being sick. Again, limiting traffic in the office, the practice. Everything that is shared in a typical office, like magazines, have been removed. So it's not passed from person to person. All areas are disinfected multiple times a day. Everyone has to wear a mask. It's hard to see anyone without a mask these days in the office, Thank goodness everyone has adhered to that rule now. We are performing all the tests that typically are done in an office, in our case in a cardiologist's office, EKGs, Holter monitors, blood pressure checks. Everything is being done, including pacemaker checks, and visits are being done either in person or at distance. Okay, there's always an option for every patient. So this is a picture of two of my partners doing what's called a televisit. So the doctor is in the office, and they are connected to the patient by any of these teleconference modes. And basically the patient can see the doctor can see the patient, and they're communicating live as if they were sitting in front of each other, talking about the patient's symptoms, going over their complaints, and if necessary, if a test is needed, then it can be scheduled for them to come in and get it done in the safe manner that I was just talking about. So televisit is something that has become part of practicing medicine these days. It's available in most practices. It certainly is on ours, on both locations. This is the whole team here. We cover a wide gamut of cardiac practice, from arrhythmias and pacemakers and defibrillators, which is my case, to the plumbing side of things for patients who need a heart cath or a heart failure visit, imaging or testing. We have a wide variety of subspecialized cardiologists in the office, and we strongly encourage you to not ignore symptoms, not put off a visit that you would otherwise want to do because of the pandemic, because there are ways to keep your risk low. You don't necessarily have to be exposed to risk and still have your symptoms addressed and analyzed by a qualified professional in the office or in the hospital. And obviously, in a situation of emergency, you can always call 911 if it is something that cannot wait. And again, this is the addresses for our offices. If you would like to get a hold of one of us, those are the two locations at West Sunset, which is where we are, and at Tenaya for the Mountain View campus. And we cover, as I said, interventional, vascular, sports cardiology, echo imaging testing, as well as arrhythmias and ablations and devices. Okay? And as I said, you always have the option to call us and decide as to whether or not you want to physically come in, and we will help you decide that, or if you want to do your visit from the comfort of your home and limit your exposure on the way to the office or in the office or the hospital. Thank you, and if you have any questions, email us at Las Vegas Heart Associates at hcahealthcare.com.